Today's episode, we are talking about home care in-home care, and I'm so delighted to have Lakelyn with me today. Dr. Lakelyn, she hosts her own podcast called Caregiver Chats, which is the Home Instead podcast. So I highly encourage you, after listening to today's episode, to go follow that podcast. Welcome, Lakelyn. I'm so excited to have this conversation.
Thank you so much, Michelle. I am equally excited. It's always so fun to talk with you about anything aging, senior care related. So I am just delighted to be here.
And it's great that we're in the same city. We've had the opportunity to meet in person. So we're just continuing the conversation. I
Absolutely.
I think one of the things for our family that we just had the hardest time with was being realistic about the situation that we found ourselves in and where things were. My mother-in-law had received a dementia diagnosis, and my father-in-law was taking care of her. And we could tell as a family that he was just really struggling to keep up with day-to-day tasks. And really, he really just wasn't built to be a caregiver. He had taken care of his mom for a really long time, and she had passed away. And it was only 2 years later that he now found
Wow.
himself in a position to care for his wife. And a lot of patience that's required when we are working and interacting with someone with dementia, he just struggled with. So I guess just in our family, we had a really hard time um, helping him move the needle that it was okay to have additional help in the home. So just, I guess with that framework in mind, let's just start with what is in-home care? What does that mean?
Yeah. Well, Michelle, your family situation is more common than you think, which actually probably just how common that is, but it is very common for families to kind of be weighing like, is it time? Are we ready? And maybe most of the family is ready and some of the family members aren't quite ready to make that leap. But I think it's important to at least learn about it. If you're in a caregiving role, learn about in-home care. So I'm so excited to talk more about it today. And really in-home care is a professional that is trained as to care for aging individuals, and they come into the home to support the individual and the family, and takes a variety of forms. The care that we provide is very customized to the individual that needs the care in the family unit. So it could be things like assisting with meal preparation and light housekeeping, like keeping up with the laundry, making sure the bathrooms are clean. It could also look like assisting with medication reminders or going to doctor's appointments, helping to run some errands outside of the home, like going to the pharmacy to get the medication or going to the grocery store to make sure that the fridge is fully stocked with nutritious foods, that going through the fridge to throw away unexpired foods, all the way to kind of more of those hands-on personal cares like bathing, grooming, assisting with incontinence or restroom needs. Um, and also, we can support individuals that have cognitive impairment, Alzheimer's and dementia. Many home care companies train specifically on that. And at Home and Said, we do have a training program, just to really enhance the independence of the person, whether they're living with cognitive impairment or not, to help them continue to remain where they are, whether that's in a residential home setting, whether that's in a care community senior living environment. Sometimes we can even support kind of one-on-one care in a hospital setting or in a memory care facility. And so really it's meeting that individual and the family where they're at, assessing what are the needs, and then, you know, helping. And at least in our organization, we take the approach of relationship before task. We also want to make sure that we're developing a relationship with the person that we're assisting because we are in their home. And so companionship is also a component of home care that I don't think gets talked about enough, but it really is important. Getting to know the person, engaging in conversation, and really being also kind of that emotional support for the individual and for their family. And I hear so many families talk about how the home care professional becomes an extension of the family. And you don't have to use home care 24/7. You can really customize it again, based on maybe the family's availability, where are the gaps in the schedule? Can home care fill in? Or is the primary caregiver still working? Can we come during the day and support mom or dad or aunt or uncle while that caregiver is working? Or is it they need a break on the weekend? So it's again, it's so flexible. And so looking into home care before you need it really can help you assess all that's possible and then figure out how can it help and support us in our time of need or in our caregiving journey.
It sounds like there are obviously so many benefits to having that additional hands on deck, those additional hands on deck. I love that you put relationships before tasks because I think so often as family members, we have a really specific set agenda that we are trying to
Yes.
accomplish when we are uh, helping or bugging someone about getting ready for the day.
Yeah.
Like we have these timelines and these time frames and how things should be done. And we have all of this history around how they used to do things or how they used to perform a
Mm,
task. And so I just think that's such a valuable approach, the relationship before task, because it removes from the family member that element of, I guess, expectations about how someone should or shouldn't be doing something. And
yeah.
it puts it into that care professional's hands to let them connect with that person.
Oh, absolutely. Well, and I think what's also kind of helpful is that care professional, they've likely been, caring for older adults for a long period of time. They've worked with multiple clients. So they can also bring maybe some new techniques and
Mm.
perspective to the situation, like you mentioned. And I think what also is kind of actually beautiful about home care is, to your point, they don't have that history with the person. So they're just seeing them for where they are today and they can appreciate where they are today and help that person again maintain as much independence. They might not have those expectations of, well, they used to do it this way. And so that can really kind of maybe be freeing for the older adult themselves. And at the same time, it can be freeing for the caregiver because, as you mentioned, caregivers are often very task oriented. They're going over maybe to mom or dad's house to do X, Y, and Z task. Well, if home care can come in and maybe replace Y and Z, then that caregiver just has to do X and then they can be the daughter again or the son again and just maybe sit and have a cup of tea instead of having to throw in the laundry and clean out the refrigerator and prepare a meal for tomorrow. They can just maybe have a little bit of that family role back that maybe they are longing for or they didn't even know that they were missing. And so again, there's so many benefits to home care um, and those are just a few of them.
Right. Well, I just think this is such a valuable part of the ecosystem because what we know is that as people are in these different phases of caregiving, that as things start to pile on, it becomes like the slow boiling frog.
Yes.
And all of a sudden, people wake up and they're just completely overwhelmed. So, offloading some of these tasks can help people have that bandwidth, which will
Yes.
allow people to stay home for longer.
Yeah. Well, and that is so true. I think a lot of times when a family starts to notice, that the household tasks are slipping or mom or dad has had a few falls or they're maybe not bathing as often because they don't feel comfortable showering alone or they're starting to kind of notice that maybe care is needed. So if you're starting to notice that more support is needed, the caregiver is doing more and more and more. Some people might jump right to, okay, it's time to make a move to a care community, and we know that those that part of the care ecosystem is so important, but so many people want to stay at home. They want to remain at home as long as possible. So if home care can come in and help even for a few months or even a few years, that can maybe delay the need to move to a care community or enhance that person's independence a little bit longer, and then also frees up some of that bandwidth of the caregiver as well. And so you're so right. It's um, if somebody is experiencing that kind of caregiver burnout bandwidth, um, kind of stress or strain, it might be the time to start looking into home care.
So what, so we hear the words home care and sometimes we hear the words home health. Is there
Yeah.
a difference between those two? And what would those differences be like?
There is a difference. And I'm really glad that you brought that up because I think that sometimes we think maybe they're the same thing, or you might assume, home health can do more than they actually can. So,
Mm.
home health is more of the kind of skilled level of care, like occupational therapy, physical therapy, having a nurse come into the home to change a wound dressing or other kind of nursing related tasks. And usually, home health care is prescribed by a doctor and usually happens maybe after a hospital stay or returning home from a rehab facility stay, or maybe there is a health event and they need some of that more medical attention when they come back home. So that's home health care. And usually, home health will come in maybe for an hour to do a very specific task. And maybe that's the physical therapy exercises. Well, that physical therapist, they can't stay to throw in a load of laundry or make a meal. And when I've talked to physical therapists, sometimes they feel so guilty because their client or patient will ask like, "Oh, can you just run and get the mail for me?" Or "Can you just throw in that load of laundry to the dryer before you leave?" And they're caring people, so they want to do that, but that's really outside of their role. And so that's where home care can partner so well with home health to kind of be that extension of care and support beyond kind of those medical tasks. And so, home care, you don't have to have a doctor's prescription for. You can really just pick up the phone and call to inquire about home care, and they can do um, that extra task or activity that again the home health care provider can't do, and it's very personalized, flexible. They are often there for hours or uh, multiple days a
Mhm.
week, where again, as home health is coming in maybe once a week, maybe a couple times a week for those very specific tasks. So it can be kind of confusing, but they are two separate services. So it's important to look into, okay, what do we really need? Do we need home health for the medical task? Or are we maybe more a better candidate for home care because we need kind of more of that broad range of care and support?
So if home health care is prescribed by a doctor, then it sounds like insurance would potentially pay for that. Maybe that would be covered under Medicare.
Correct. Often, if it is prescribed by a doctor, there is a chance that Medicare will cover the service of home health. Um, there's a lot of very specific criteria around that. It can be a little overwhelming. So, usually, if you are discharging from the hospital, meaning coming home from the hospital or a rehab facility, there's often a social worker involved, a discharge planner that can help answer some of those questions about the payment around home health. And actually at Home Instead, we created a guide. It's called a home
Hmm.
care guide. That's really helpful. And Michelle, I'll make sure we get you the link. So maybe we can include it in the show notes. And the
Great.
guide helps to differentiate between home health and home care. And then we also have a guide around funding. And so it kind of overviews the funding options for home care versus home health. And home care right now, unfortunately, not covered by Medicare. Some Medicare Advantage plans are starting to kind of dip their toe in home care, might cover a few hours here and there, but home care is funded differently. I'm happy to go into that, Michelle, if you want, but it is primarily private pay, or your long-term care insurance policy might cover home care. If you're a VA, uh, your VA benefits might cover home care. So there are a variety of options to pay for home care, but a lot of people sometimes assume, okay, Medicare does cover that, but that's unfortunately not the case for us here in the U.S. today.
Well, I guess what I'm hearing is there are a lot of options and we don't want to make any assumptions. So if we are finding ourselves in a situation where clearly someone's care needs or emotional well-being needs are not being met and they are needing that extra assistance, it's worth just making the call to find out. It's worth
Absolutely.
just being curious and investigating it.
Absolutely. And I think you're right. Let's not make assumptions that maybe they can't afford it, or maybe they don't have a funding mechanism because there are more options than maybe you think, or maybe the amount of home care that they need is really only a couple days a week to help them maintain their level of independence. And so if you weigh that against making the move to maybe a community living setting, maybe right now where they're at, it doesn't make financial sense to make the move yet. Instead, let's invest in the home care that they might need a few days a week to enhance that independence. And again, keep them home, probably where they want to be, because that's where most people want to be for maybe another few months, 6 months, even a year longer to maybe delay that move. So, and I think the other great thing is with home care, you could start out with a few days a week, a few hours at a time, and then build as the person's needs maybe advance, or maybe if they have a progressive disease like an Alzheimer's or dementia or Parkinson's, as they start to need more care and support, you can always grow the number of hours or add a few more days a week for that extra assistance. It doesn't, once you set a schedule, it's not set in stone. It can be
Okay.
modified.
That's great. That's reassuring because there's a
Yeah,
lot of ebb and flow with illness. And so maybe
absolutely.
somebody is in a really heavy lifting period of time when they need that extra care, and then they can scale back to some of the lighter duty tasks, and then it can ebb flow
Absolutely.
again. How do people go about finding home care? Like what are some things that they should be taking into consideration as they look?
That that's important to consider because of course if you google home care you're going to have a lot of different search results that come up and that can be overwhelming. I would say if you know somebody who has used home care, ask around, ask fellow caregivers, ask friends and family, have you used a home care provider? And I would suggest looking into a few, interviewing a few home care providers so that you find one that's a good fit for you and your family. Of course, you can always go to Home Instead's website and do a zip code search. We are national and even international. So there's likely a Home Instead near you. But again, um, assess what home care providers are available in your area. And some of them are agencies, like we are at Home Instead. We directly employ our care professionals, but there are some registries. Like you see a lot of commercials on TV right now for caring.com. They have babysitters, but
Mhm.
they also have elder care providers or senior care providers. And so registries, that's more of kind of a listing of providers where you can go on and you can read a little bit about them. Maybe they've done some background checking, but then if you hire them, you really become the employer of that home care provider in your home. So you do want to make sure that you look into whether or not you want to hire an agency or if you want to hire someone independently, because it's important to consider both. There's pros and cons to both. In the home care guide that I mentioned that we have free online, it kind of walks through some of the pros and cons of both. And so those are some questions you want to consider. Do we want to go with an agency that really takes care of all of the payroll and taxes and they're bonded and insured, or do we want to have someone that we employ directly? Um, and then when you do look into the provider, no matter kind of which way you go, you want to ask, what is the training? Because it does take a special person to care for an older adult. And so ask, what kind of training does the care professional undergo? Especially if somebody has cognitive impairment, Alzheimer's or dementia, do they have that kind of a training program? You'll also want to inquire, do they have any minimums? Some home care agencies or independent providers will have a minimum number of hours per visit or the minimum number of hours per week that you're
Mm.
required to use. You might be able to kind of split that up over multiple days, but that's really an important question to ask. And then, of course, you want to ask about pricing because sometimes there's kind of a tiered level of care. If you just need maybe some companionship, light housekeeping, meals, that might be, kind of the base rate. And then if you need more of that hands-on care assistance, it might be an additional charge. So again, those are really important things to understand. And usually in a care consultation, that's what we call it at Home Instead, that initial meeting when they come to the house, it's usually free. So that's a great way to just kind of dip your toe in, learn about the service, get to meet the people from the agency. and ask all your great questions. And during that consultation, they'll be able to kind of talk you through their process for getting started, the fees associated with it, and they can again outline, how they train and employ their workforce. So those are just a few of the questions. There's probably definitely a lot more that you might want to consider asking, but those are, I would say, are some of the most crucial questions.
I think the training is especially important because I do believe that having those hands-on experiences, so someone who's independent, that has had that hand-on direct experience is huge. That's a critical factor. And it's really
Absolutely.
important to be up to date with training and making sure that we have the latest best practices
Yes.
available, and just different thought processes. Like, this is an ongoing journey for family members. And so when organizations are investing in their team and they're happy with who they're working with, then they're more likely to show up in a way that's really supportive of the family.
Yes, that's so true. And for us at Home Instead, we have a robust training program, and that is important to us, is making sure our care professionals are equipped to do the jobs and tasks that we're asking them to do. But also we teach them about that relationship-based care too, so that they know how to form relationships and in a professional manner. And so yes, that training component is very important.
I was thinking, reflecting on how, just like, I think when we first started with some home care for my mother-in-law, it was 2 to 4 hours a week. And the thing that really tipped the scale for our family was her incontinence had increased. And so there was just an increased need to be changing bedding a little bit more
Mm.
regularly. And physically, it just became this task that was so challenging for my father-in-law. And ultimately, we learned it was because he actually had cancer
Oh, wow.
that had not been diagnosed yet. But we were like, oh, well, that makes sense why this is such a simple task. It feels like it's such a simple task, but it was physically taking a toll on him, just changing the
Mm.
bedding. So I guess where I'm going with this is, I understand that it feels like, well, I should be able to do all of these little things because
Mm.
they're simple little things. And I've done it for this huge chunk of my adult life, and I should be able to prepare meals. But then there's really just the physical labor that comes with
Yeah.
having to stand on your feet and actually cook and prepare a meal. The demands can sometimes be too much. So I guess where I'm going with that is, we have as humans this protective feeling like, well, I should be the one to do this, or I should be the
Mhm.
one who should be capable of this. And I think as caregiving needs increase, it's just we hit these walls.
Yeah.
So, how can we encourage people to go ahead and make that call? Just inquire about it, just to be willing to get curious and inquire about it.
Well, I think you're right. Taking that first step to make the call is often the biggest hurdle. But what we see a lot happen is there is an event and it triggers a crisis, and then there's no other choice but to make the call. So
Mm.
hope that for those listening, what you take away from this conversation is make the call before the crisis, because you're in a much better headspace pre-crisis. So you have um, maybe more time, the luxury of time to look into this type of care. And I think too, you might feel, to your point of, I should be able to do this. And I think one of the beautiful things about home care is the home care professional will come in and they're not going to take over everything right away. They're in your home. They want to be respectful. And if you love to cook, but maybe it's too demanding for you, uh, you can sit down and chop one element of the meal and still help the care professional in that meal prep process, but you're not having to do it all yourself. So I would also challenge people to consider, how could this help me enhance my independence or keep continuing to do the things that I enjoy, but maybe in a more manageable way. But that first step is picking up the phone. And I would just encourage, if you're thinking about it, to call home instead, call maybe one or two other home care providers as well, and just learn about the service. And sometimes if you're being met with some reluctance, maybe it's from the older adult themselves, that your family member, loved one, person you're caring for, you might want to just have them be open to trying it for a period of time. And Michelle, when you were on my podcast, we talked all about overcoming the reluctance to care, and we talked about how, maybe set up a little bit of a trial period and just see how it goes. Because sometimes people also think, well, the minimum is 3 or 4 hours. I don't need someone for that amount of time. What will they even do? I don't want to have to entertain or babysit the care professional. And I think people are surprised at how quickly 3 or 4 hours can go by when you start to realize all the different things that they can do to support you in your living environment. So maybe you set up the care consultation, you have the home care provider come to your home, talk to you about the service, and you decide, okay, you know what, let's try this for 30 days and see what happens. Just see how we like it. Kind of set up that schedule and then reevaluate, after that trial period or 30-day period,
Mhm.
to say, like, how is it going? And often the home care agency that you're working with will check back in periodically, ask how it's going, see how kind of the care pro match is working out. And
Mhm.
that's one other thing I would say, when you're thinking about home care, if you don't get kind of the perfect match on the first care professional, don't give up on home care, because sometimes, just like in life, we don't always get along with every single person that we meet. It might just be a personality difference. And so if you have a care professional come and you feel like, oh, it's not the right fit, don't be afraid to tell the home care agency that you're working with, hey, I'm not sure about this care professional. Could we try someone else? Sometimes people feel guilty, like, oh, I'm taking away their hours, or I don't want
Mhm.
them to get in trouble. And we're not thinking of it that way. We just want to make a really good match for the families that we work with. And so don't be afraid to speak up and say, can we try someone else? And sometimes it might take a couple matches to find a really good fit. But let me tell you, one of the coolest parts of my job when I worked at the local home instead and I did care coordination was when I got a call from a family that said, "Oh, we just love our care pro. They're awesome. We want this care pro all the time." That was the most fulfilling part of my job. And so when there is that great match, it can really be magical.
Well, I know it made an exponential difference in our family once the in-home care started. I mean, it really was the ability to not only take some pressure off of my father-in-law for having to do everything, but it also just changed the dynamic of their relationship, having that care pro
Mm,
partner in the home, because they could focus on something other than her disease process, because
yeah.
otherwise they were just really sitting there, sitting in it. And this person would come in and really was just such this great energy and brought different topics of conversation to the table or different activities that they would do together. And they all just really enjoyed it so much.
I'm really glad to hear that you had a really positive experience with home care, Michelle. And that is, things that we hear often is, it brought somebody new to the dynamic, somebody to listen to those stories that we've heard a million times. So it's fresh
Mhm.
ears. It's just somebody, and what I think is neat is we have care professionals of all ages, from 18 to 85. And so sometimes there's a great match from a kind of generational perspective too, both maybe someone that's from a similar generation, or maybe that intergenerational connection where our client is teaching the care pro one of their, favorite cooking techniques, or the care pro is teaching the client a little bit about technology. So I think that's another really neat component to home care is just the unique interactions that take place. And also so many families feel very supported too. It's kind of a sigh of relief. And also, maybe the family members learn a new way to approach the bathing situation or a new technique to redirect if there's a dementia related behavior like agitation. They learn that from the care professional. So I think if you can approach it from the lens of being open to having some extra support, to having kind of a mutual kind of learning and respect between the family and the care professional and the older adult, I think that home care can be so beneficial for many families, especially ones that are that feeling that burnout or starting to notice needs change.
We as humans are designed to be in community with one another. We are
Yes.
designed to need each other and leverage each other's strengths. And I think we've just shifted to this real sense of independence that we are supposed to be the ones to do it all. And I love the idea of people weaving through in-home care sooner rather than later so that they can start to build that community of support and resources for themselves. And I know that Home Instead has a lot of additional resources. So in addition to sending that Care Pro to a house, your website is also really robust. What are some of the other things that Home Instead makes an effort to help people with?
Yes, we have a lot of free resources on our website. I'll send Michelle the link to that, the care resource section of our homeinstead.com site. You can do a search for really any topic on aging, anything from kind of a home safety checklist. We have one of those on the site. We have these various guides that I mentioned explaining what home care is, how to fund home care. We also have a lot of resources if you're transitioning home from the hospital. We have some tips on preparing the house or tips to avoid hospitalization so that you're not going to the hospital. We have, severe weather tips out there. If caregiver stress tips, if you're feeling kind of that stress and strain. So really there's categories at the top of the section. And so you can kind of click through, or if you have an issue like incontinence that you're facing, you could type that in the search function, and there'll be a multitude of resources there, and also the Caregiver Chats podcast, as you mentioned at the top of this, Michelle. We twice a month have a new episode on our Caregiver Chats podcast. You can find that anywhere that you like to podcast, Apple, Spotify. And then I also do a professional webinar series. So if you're a professional listening and you want free CE credits, continuing education credits, we do a webinar series in partnership with American Society on Aging. And each month we cover a new topic. So you can also find that on our website as well.
Amazing. What would you like to share with families as we wrap up here? Like a final thought of encouragement or anything that's coming to mind to share with those caregivers, those families out there who are trying to figure this out and do the best they can.
Well, I have so many thoughts. It's hard to pick just one, but I would say, and I always end my podcast with this kind of phrase of it's important to take good care of yourself while you care for others. And often caregivers put themselves on the back burner. But the fact of the matter is you have to make sure you're taking care of yourself so you can continue to care for the person that you're supporting. And so I think home care is one piece of that puzzle. It can be that respite, that break, that chance to recharge, that chance to give you back a little balance in your life as a caregiver. And so that those little things that you do to kind of help you take care of yourself will also help you take better care of the person you're supporting. And we know caregivers work so hard. They pour so much of themselves into this role. And so I also just want to say thank you. You're doing an amazing job. It might not feel like it, but the care you're providing it to the person you support is so important. And the world needs you as a caregiver. Your loved one needs you. And I would just want to say thank you to all the caregivers out there.
That's beautiful. Well, thank you, Lakelyn, for being here. So grateful for your wisdom and your time and all of the great resources that you shared with us today. Thank you so much.
Thank you so much for having me, Michelle. And thanks for all you do to bring uh, experts, resources, topics to your listeners. I really enjoy your podcast and enjoy following all of your work. So thank you as well.